Right. I want to welcome everyone to the Live Well Kalkaska Substance Free Coalition's Coffee with the Coalition Forum. This is an open and informal discussion about substance disorders and related topics and concerns within the Kalkaska community and Northern Michigan. So I'd like everybody to introduce yourselves, except for you, Kathy, I'll introduce you. So Nancy, just introduce yourself and what you do in the community.
I'm having trouble hearing you.
Okay.
Can you hear me?
Yes.
Okay. I'm Nancy Bryant. I'm a member of the board of BDAI. I'm the co-leader of our Stronger Together group with Suzanne. And Kathy Sanders and I know each other from all kinds of places and work together. I'm delighted to be here and hear about BDAI and how it can be helpful to our friends in Kalkaska. Thank you for having me.
Yeah, thanks. Tim?
Hi, I'm Tim Hudson. I'm a behavioral health consultant with the University of Michigan, specifically the program called Michigan Opioid Collaborative, and I cover the northern 21 counties.
All right, thanks for being here. And I'm Suzanne Prince. I am the coordinator of the Live Well Kalkaska. Whoops, just a second, I got people coming on. Okay. I'm the coordinator of the Live Well Kalkaska Substance Free Coalition. I'm also a board member of the Grand Traverse Families Against Narcotics, and I'm the co-facilitator with Nancy for Local Stronger Together, and along with a bunch of other different things. Oh, and I'm a prevention specialist for Kalkaska with Catholic Human Services Up North Prevention. That is definitely an important thing to mention. So right now we're introducing ourselves. Caitlin, could you introduce yourself and what you do in the community?
Hi, my name is Caitlin Kuski, and I'm the executive director of the Community Recovery Alliance up in Petoskey. And I was shared your link because we were really interested in this program, the Traverse City one, so we wanted to hear about it. And I'm actually here with Thomas, who is brand new, works for me as of yesterday. Okay. So we just both wanted to sit in and learn a little bit more, and so that we can hopefully, do similar programming up here.
Oh, that's awesome. Thanks for joining us. Thomas, do you want to introduce yourself? You're on mute if you're trying to talk.
But he was on the go this morning, so I don't know if he can talk.
That's fine. So I just want to remind everybody that you're being recorded, and that we will be placing this on the Up North Prevention YouTube channel so people can watch it within the community. And I'll share the link on the Live Well Kalkaska Substance Free Coalition's Facebook page as well, and other Facebook pages. Thomas, do you want to introduce yourself now?
Unmute.
Yeah, sorry about that. I was having problems with some Wi-Fi issues, but my name's Thomas LaForest, peer recovery coach and the new program or judicial programs coordinator with Community Recovery Alliance, as Caitlin had said. Excited to be here today to learn as much as I can and offer some insight if I have it to give.
All right. Well, thanks for being here. Appreciate it. And just to remind everybody, this is just a laid back conversation, very informal. So I'd like today we want to welcome Kathy Sanders, communications coordinator for before, during, and after incarceration. Kathy is here to tell us about the group based in Traverse City who provide assistance and programs to individuals and their families, excuse me, before, during, and after incarceration. Go ahead, take it away, Kathy.
Okay, so I am going to share some slides, if it'll cooperate with me. So give me a minute here. Okay, so before, during, and after incarceration is a local nonprofit group that started about 4 years ago. Tom Busamra, who is our president, along with Tony Stanfield, who is our vice president, saw a need out in the community as well as in the Grand Traverse Jail for a program that could support the needs of not only the inmates, but also their families, and recognizing that there certainly is a need before incarceration, hopefully with programming that helps with jail diversion, as well as while they're incarcerated, and then, certainly follow up assistance after they leave the jail. So, as I said before, it's an advocacy group for the incarcerated, previously incarcerated, and their families. And, our mission is to really strongly engage the community. Together, we can do quite a bit. Standing alone, it's that much harder. So success for people and their families come through support and building relationships, finding those alternatives to incarceration. And then it's important to engage the local and the statewide stakeholders so that we can make this all possible. So one of our goals is to humanize the faces of the incarcerated. Unfortunately, there's a lot of misperceptions. People don't really understand who's incarcerated or why they're incarcerated. A vast majority of the people in the Grand Traverse Jail, have yet to await their trial or sentencing. So, they haven't been convicted yet. The jail is a short-term, hopefully a year or less, although since COVID and the courts being backlogged, some of those incarceration stays are lasting longer than that. But, the idea is that if they're convicted, they would move to a state prison, be part of the Department of Corrections. If they're innocent, then of course they're released. So we advocate for programs that'll improve diversion from jail, rehabilitation services in jail, and successful community reentry. So how do we do this? A big part of it is family support. Addiction and mental health advocacy is huge. Wayne State University a couple of years ago did a large study of the jail and looked at people that were experiencing either mental health or substance use disorders or a co-occurring condition. And they found that 38% of the inmates at that time were experiencing severe mental health concerns. And about 33% were experiencing substance use disorders. And a lot of those overlap in both groups if it's co-occurring. We feel strongly that supportive release is key to prevent people from coming back, and so that they become productive members of the community, and they're successful in keeping healthy and doing what they need to do for the community and their families. So we strongly believe in restorative justice advocacy. If someone was harmed, doing that restoration work to the individual that might have been harmed, the individual recognizing the impact of that harm, and hopefully healing can take place through that. Communications is an important key to all of this. And then, of course, fund development so that we can do programs that are going to help the incarcerated and their families. So, family support. We provide a monthly support dinner for families. It's the second Tuesday of the month at St. Francis Parish Hall. Runs from 5:30 to 7:30. Anyone is welcome to attend that. We strongly encourage, if anybody here would like to attend, just, show up. More the merrier, spread the word. So it's not only for the previously incarcerated and their families, but also that community support network that is out there. And initially when we started, it was a lot more volunteers than it was people from the incarcerated community. That's starting to change now as people become more comfortable with being there. We have one family that has several children that have been attending almost from the beginning. And the mom says that without the support dinner, she really doesn't know what she would do, because it's become a friendship and support group for her. People help, with needs she has on a daily basis. And, it's just been a great experience for her and her kids. So we provide emotional support. We help with resource coordination for family members. Where can they go if, they're in need of housing or financial services or food. So we connect them with the agencies that are already out there and doing those kind of things. And then we update the families on our organization and what is happening out in the community with health issues as well as justice reform. Supportive Release, BDII, provides beta vouchers, clothing vouchers, and food gift cards to those who are in need at their release. And one of the grants that we recently received allowed us to assist with tethering and testing costs for those that can't otherwise afford it. That has been huge because it helps people be successful, get back on their feet, and avoid being violated for probation issues. So we're currently looking into writing more grants because that was so strongly popular. We're actually out of our original funding, and we're looking for ways that we can renew that and build a real positive relationship with community corrections as well. Our BDAI coaching program, every few years, we run a training program to train coaches that are assigned on a one-to-one match basis so that when people are released from jail, they have someone out in the community that can assist them with resources, help them find employment, connect them with all those community agencies and nonprofit groups so that they can be stable when they get out and hopefully not reoffend. And the coach and mentee meet weekly once released, often check in daily, via social media, so that, our phone, so that contact is there if the individual needs it. Addiction and mental health advocacy is huge. As we said before, a large portion of the jail population does have health issues related to both addiction and mental health. So we meet on an every other week basis with jail administration, getting continual updates. Tony Stanfield serves on an in-house committee that evaluates the present health provider. There was a change about a year ago, and a new provider was brought into the jail that covers both physical and mental health. We're constantly reevaluating that. Quite honestly, there's still room for growth in what is happening with that provider, but we've substantially increased psychiatric time so that individuals are waiting, probably a quarter less than they used to in order to see or talk to the psychiatrist. We recognize the need that integrated health is very, very important, but staffing has been a concern. They're still looking for a social worker to join the program so that they can be fully staffed. The Community Crisis Support Center that were known as the Wellness Center that we've been working on with another group, hopefully would really help solve those gaps in the mental health crisis care continuum. So we can talk a little bit more about that later. We're actively working to encourage law enforcement and other local agencies to look at mobile units out in the field so that when a crisis arises, if it cannot be resolved over the phone, that we can get the help that is needed actually to the site and to the individual. We also have life skill classes for the incarcerated that focus on topics of self-esteem, grieving and loss, successful communication, anger management. So earlier I talked about the mental health continuum of care, and we have gaps in the community that we really feel need to be addressed, and hopefully professional services expanded or initiated in these areas. So some of the areas in red that someday we would like to see is a psychiatric emergency room, because right now, if an individual is in crisis, they're basically are three choices: the emergency room, jail, or just recently, Community Mental Health has put in place what they call the Welcoming Center, which is a 24-hour short-term crisis triage center that triages the individual, hopes to help alleviate the crisis situation. But if not, we'll refer them to where they need to go. But that's where our gaps kind of come in, because Northern Michigan, unfortunately, does not have full-time resources that it should have in the areas of long-term crisis stabilization. So one of the things that we've been working on in collaboration with the Northwest Michigan Shire Group is to establish a Grand Traverse Wellness Center to address crisis stabilization on a longer term basis. So crisis stabilization unit would be up to a 3-day stay. A crisis residential unit would provide care up to 14 days. And then if it's still the need is severe enough, referral to a state or private psychiatric hospital would come into play. Right now, the closest psychiatric hospital is south of Grand Rapids. There's just a huge need in this part of Michigan. Children's beds, same thing. We have 16 beds at Munson for short-term residential care, but there are no beds for children. So other BDAI support services for the incarcerated, Deacon Tom, along with others, provide pastoral visits. They've just recently gone back to doing those in person. Previous to that, they did virtual visits via Zoom. And as you can understand how isolating COVID was for all of us, you can imagine how really isolating it is for incarcerated individuals. So this is just a really huge part of helping individuals while they're incarcerated. Letters of support to the incarcerated. There's an LFE program. You can get more information on that on our website. Supporting the book and art supply collection and the library organization, so people have things to occupy them while they're in there. And we've been working a lot with the local justice reforms, educating the community on what criminal justice reform is all about, working with bail reform, and looking at ways that individuals can address their crimes with not necessarily being incarcerated. We would really like to see mental health court come back. Certainly the drug and alcohol courts were strongly supportive of. But again, it takes that support so that the individuals can be successful, because some of those courts' requirements, the bar is just extremely high, and it's hard for individuals to comply in some cases. So we also outreach to local, state, federal policymakers, and we've been doing media outreach to let people know what's available and what is happening in the Grand Traverse Jail. Fund development is a huge part of this because if we're going to be providing programs like the testing, tethering, support to families or individuals, once they're released, it takes funds to do that. And BDI is a 501c3 nonprofit organization. So we do grant writing. We're presently doing a fund appeal. Communications, we do have a website. It's bdaiconnect.org. So we have resources there. I manage that. So I'm continually trying to add more and more resources. So it's kind of in a constant state of development. We also have a Facebook group that anyone is welcome to join. Just send a request and we will do that. And we're continuing to expand our mailing list so that we can keep people updated and we can help as needed. So for more information, that's our email address. And in the recording, you'll see this, and maybe we can send it out as well. Our president, Tom Bruce Samra, his phone number, he welcomes calls if you have questions, or, you can send them via the email and I will get back to you. And thank you very much. Any questions?
Thanks so much.
I've got a question. Do you guys have paid staff?
We do not. We are a 100% volunteer organization. We're still rather small, still kind of getting our feet wet in a lot of ways. Nancy is also a board member. Nancy actually has been involved longer than I have. So she's a great resource if you have any questions.
Well, this is wonderful. I'm so excited. I was not familiar with the program, and I'm really excited to learn about it. And we're always here to help too. So any way we can help. I know you guys are Grand Traverse, but we're a little bit further north, but I'm really excited. I think that's great.
Yeah, we're actually finding that there is so much crossover, and it's hard to say support stops at the county line. So we're beginning to reach out more to northwestern Michigan and 5-6 county area rather than exclusively with Grand Traverse. When we first got started, because of the work in the Grand Traverse County Jail, we were kind of limiting the Grand Traverse, but I think we're reaching out farther these days. So yeah, I would appreciate any information on what you guys do, and I'd be glad to put it on the website as a resource if you'd like me to.
Great, thank you.
All right. So the tethering and test costs, that's big.
Yeah.
It's huge. Because we know a lot of times when people are released, they don't have a job. They get out and then they find themselves digging the hole deeper and deeper, and they're not doing it on purpose. They just don't have the resources. They don't have any money when they get out, and they're expected to pay huge costs for their tethering and for their tests. And there's just no way. Plus, trying to find a place to live, and a lot of times, usually they have to have a specific place to go to, but that doesn't always work out. And so that's awesome.
Well, and that's one area that we saw that no one else was really assisting with. There's other agencies and groups that are doing housing and food and clothing, employment, but we weren't finding anyone that was doing support for testing and tethering. So individuals were coming to us, and that's like, we're desperate. We don't want to go back, but we just don't have the funds to do it. So.
But somebody had mentioned something about you were possibly handing out backpacks full of personal hygiene products. Are you guys doing that or no?
We did for a while, and we also did clothing, because often people would come in the summertime in shorts and sandals, and then they'd release them, the first week of January, and that's all they'd have. But since then, we've been kind of doing an inventory of other groups that are out there, and to avoid duplication, so we can put our limited resources into areas where there's not assistance. We haven't been doing that as much lately.
Okay, so thank you. I have a question about that because we want to start doing that up here. So
Okay.
it wasn't that it was unsuccessful and you stopped doing it. It was because other people were kind of doing it already.
Right.
Okay, great.
We actually do that in Kalkaska. We have a string backpack with our logo on it, and we fill it with personal hygiene products, a gift card for breakfast, a Narcan kit, a personal card from us of encouragement, a letter of encouragement, a bunch of other different things that I've been throwing in these little ACEs stress balls.
Oh, great.
And then Fan has a, the stigma workbook that they have.
Mhm.
I've been throwing that in the backpacks as well. And even though our jail is currently closed, and our inmates are kind of either they go to Leelanau or they'll go down to Wexford County, they're returned to be released. So we're able to, the jail hands them out as they're released.
Okay.
Wow, I didn't realize Kalkaska was closed.
Me neither.
Yeah, it's been closed since the spring, and we're hoping it will open again because we actually were going to go in last spring and offer ACEs training to our inmates. We had ACEs training for our law enforcement, and that went over real well. And we wanted to go in and have a continuing class for each time new individuals came in, just to talk about trauma, resilience, and how trauma is related to substance use disorder and other mental health conditions.
That's fabulous.
Yeah, so if you ever want to offer something like that, I can hook you up with a great lady that she should have her master's trainer certificate here real soon. I don't know if you know Sharon Vreeland, but she's our trainer, and Mary Grumman. And it would be a great thing to be able to bring that to Grand Traverse County.
Yeah, that would be fabulous because we're hoping to, because of COVID and because of problems with staffing at the jail, we haven't been able to fully reinstitute our skills classes. And that one would be huge.
Yeah.
I know the captain also has been doing jail training programs, and they're working very hard to hopefully get an in-house crisis intervention officer in place. So hopefully that'll be starting soon, and that would be a huge part of that. So
Yeah,
send me the contact information.
absolutely. Yeah,
I want to make a comment about expansion out of one community or something. One of the things that really happened with the COVID was that Zoom became available to so many of us. And one of the things that Suzanne and I find is that we have people who cannot access Stronger Together programs or other issues that will get involved in, say, in the Kalkaska program from the UP and from other counties and so forth. So I think that gives us access to a greater group, and we've always welcomed anybody, even if they aren't from the local area. So that's, it's hard to get transported to have meetings and so forth for some of these folks. So I think using Zoom is probably something we're going to have for a long time.
That's a great idea. And I know, especially for families,
Yes.
If you've got young children at home, you want to go to that in-person meeting, but, there isn't childcare available or what have you. So, yeah. And it's just as our resources are more limited, it's trying to find professional staff in these areas. I know has been a real struggle for our agencies, and even volunteers, there's a finite number. So the more we can find ways to work smarter and not harder, excellent idea, Nancy.
I have a quick question. So you guys said that you've been running your program for approximately like 4 years, right?
Mm-hmm.
I'm certain that there's probably been a great impact in reducing like recidivism. And have you been able to like measure the data that you've collected and put any numbers on like the recidivism? Has it lowered it?
We have anecdotal records of that, but unfortunately, and this is something that we continue to advocate, lobby for, there's not consistent record keeping between the courts and law enforcement. They're starting to move more in that direction, but yeah, it's been hard. Most of the data that we've been able to get is when programs like Wayne State come in and do their Stepping Up program. So we're hoping that they can do another study on exactly that, what kind of changes are taking place after these interventions are put in place.
And a follow-up question, you mentioned that you're doing a letter, basically writing letters to the inmates. Two questions on that. First, how do you identify which inmates that you're able to write? Like, how do you gather that information? And secondly, how has it been received? Has it been well received? Because I know that it is your goal to build obviously connections, authentic relationships with these individuals to strengthen ties to the community. How has that been received, that particular area?
Okay, we actually do that in partnership with the full-time chaplain in her ministry, which is Keys to Freedom Ministries. So she originally initiated the program. She also kind of chairs the library and arts and crafts program, and we support that and get the word out. But we are more the supporting group rather than the initiating group. And because she is the full-time chaplain in the jail, she's there and sees where the needs are most strongly, who's going to be there longer term. I mean, some people come in and they're released, within a day or two. Yeah. Others, are there much more long term. So those are the individuals that have the greater need. Also individuals that don't have the family support out there. So she's able to identify that. And, from what I've heard, it's really appreciated, because there's no longer in-person visitation in the jail. They can do video calls. But, if you don't have that family member out there or a friend that is willing to be part of that and pay the costs, those letters are kind of, another step for just having support.
We're starting an organization. Actually, we just got registered with the state today, but we're calling ourselves Inspired for Recovery. But the program we're launching, and I didn't know anything about Keys to Freedom that's being ran there, but the program we're launching is called Keys to Freedom. And it's based on building strong, authentic relationships with inmates and helping them identify any barriers prior to the release, and then navigating those barriers, and then helping them reintegrate back into the community and building those relationships prior to them getting out. So it's really fascinating. You guys have the same exact name for the program that kind of does the same thing. So I developed the program when I was in prison years ago and never seen it come to fruition. So it's awesome that a chaplain is actually doing it in the Grand Traverse County Jail and that it's being well received. I know that letters mean the world to people that are incarcerated. And, really, if we want to welcome them back to our community, then we have to be authentic about it. And So it's so exciting that what you guys are doing. And I would love to be able to be a part of that, vision and mission with you guys. So.
Yeah, definitely. If you want to reach out for more information.
I took down Tom's number so I could.
Okay, great. Yeah, the chaplain that runs Keys to Freedom Ministry is Tina McCauley, and we work closely with her. The coaching program, we run somewhat independently. They have their own program that they run, but we actually do our coaching meetings at their facility. She has a building where people can drop in and get post-incarceration support, use the computers to search for jobs and that kind of thing. So, yeah, takes a village.
Any other questions? I started going to the meetings. How long ago was that? That was probably about 3 years ago.
Yeah.
It was about 3 years ago, and then COVID happened.
And anybody's welcome to attend our board meetings. We've been doing in-person meetings again, but we're not meeting quite as often as a full board. We meet quarterly, and then in between is time to do our committee work. So, but anybody's welcome.
Nothing else?
I appreciate you ladies so much coming on and sharing that. That is very inspiring. Personally for me also, that like I'm working now with CRA, and they've been wanting to do the jail release bags and then kind of like pilot our program that we're starting. And to hear that you guys have already went ahead of us and are getting great results just encourages us, because we want to bring it to this community where we're at as well. And it's inspiring. It's awesome. It's needed, and I'm glad that other people see it.
Thank you for your work, Thomas.
Thank you.
It's just unbelievable what how you have moved towards this work and then are actually building it off. So thank you.
And if you know of any families that need support, you can, if you get on the Families Against Narcotics website and go to Stronger Together, you can find our link,
Yes.
link to our Stronger Together group that we facilitate. And it's via Zoom. It's always via Zoom because we have so many people from different parts of the state. But, we know that substance use disorder and incarceration go together.
Yeah.
So a lot of times they need support for both. So you can connect us to, or connect them to the group, and we'd be happy to have them. We have some great conversations.
Which fan chapter are you?
Grand Traverse.
Grand Traverse. Okay, cool. Wonderful. Well, and I second all of that. And I feel like this was a tailored conversation for Thomas and I, but we learned so much and I can say that we're excited. Yesterday was our first day and we have all these ideas. So it just like reinforces everything we've been talking about wanting to do. So.
Well, and thank you so much for doing the family support. I have a brother that had substance use disorder, and back when he was struggling, there wasn't a lot of support out there for families, and you feel very isolated and very alone. So that's just huge. And not only in supporting the individual with the SUD, but, that family member that needs to support that person. So, yeah, that's just huge. And thank you so much.
Well, there are a number of training programs now that focus on family support. We do have folks who take them. I also have a son who was addicted and spent time in jail. And at that time, there was just no information and such a stigma against those kinds of things. And I think we're we're changing that by doing it locally, so that we know names of people, and people look out for someone they can talk to when they need to get some information. So, Thomas, I've had the peer training as well, and that was a wonderful program. They let me come, even though I wasn't a peer at the time. So get your folks out there learning about this disease, so we can get it under control. It needs so many things need to happen now, and one by one is how we do it.
I'm also, oh, go ahead.
I had another question. You had mentioned that you were running educational classes in the jail, that you were providing them to those inmates. How were you doing that? Was it via in person or via Zoom?
Actually, it's on hiatus. When COVID hit, we weren't able to go into the jail, and we're hoping to get in soon. We thought we'd be in like 3-4 months ago, and then the jail lost several people. So they were going through a staffing crisis. So they've hired new people. They're in training right now. When they're fully trained, we're told we should be able to reinstate those classes within the next couple of months.
What we did was to come together and create a curriculum that we thought would be appropriate. And then there were a number of professional people that might have been involved in the various aspects of the curriculum that had been developed, who were either working at it professionally themselves, but these were people who knew what they would be talking about and had some experience in teaching. So that group is still around, and we are now revising the curriculum, and we'll be having people who will either volunteer for, and it's kind of complex because you have to deal with the women separately from the men, and well, anyway, but it is something that could be done and could
There's
be
a lot of
very useful.
logistics involved.
Yeah.
Because everybody has to be trained for jail clearance because you're actually in the jail. So yeah.
Well,
That
but
is awesome.
the inmates so love it, and they participate in those classes. You get a lot of interesting feedback.
There's been a lot of research that's been done that's shown that, like, educating somebody that's incarcerated is one of the keys of greatly reducing recidivism.
Amen.
And also, when you educate on like substance and alcohol use disorder, it helps to reduce, stigma, shame,
Yes.
bring awareness. I mean, great things. One of our plans, and we would like to definitely include you guys in this, is we want to take this to the state prison level eventually as our long-term goal, because I did 11 years in prison, and when you go in, you have to take a vocational trade. Well, the vocational trades that you have to choose from, you're not likely to actually get hired for one of those positions when you get out of prison. We want to advocate for them to offer peer recovery coach training as one of the vocational trades, because it only makes sense. Being a peer recovery coach, my experience is what qualifies me to do this position. And so we would like to definitely stay in contact with you. And when we get to that point in the road where we're able to put it together, we'd like to say, well, look, Grand Traverse County has before, during, and after incarceration that's been doing this in Grand Traverse, Kalkaska County. These are the results they've had. We've been doing it at Otsego, Emmett, or wherever counties we're currently. And to create a persuasive argument for them to allow us to really just better our communities is what it comes down to. Create stronger and healthier communities. And so I am so happy that I got an invitation to come to this today. Thank you.
Well, we need to collect data, and you do too, because every grant proposal that we go to, they want data about how successful, and that's something that we have not done as much as we want to. But I think I think there are places that have done
Yeah.
exactly what we're talking about and have data, and we know it works. You know, and that's the background for our moving forward for data collection and so forth. So anyway,
Awesome.
I think, I can't remember exactly what it is. I'm trying to find it now, but a large majority of inmates have very high ACEs scores. And, because they've gone through some sort of trauma. And, it's kind of surprising that there was only 30-some% with mental health conditions, 30-some% with substance use. And actually, that's probably, like you said, crossed a few, they probably both have both.
Right.
I would assume that it's probably even higher than that.
in the
I would-
60s, in the 60s.
Well,
Well,
and
that's-
that was
I would guess-
any kind of medical or mental health, such as mild depression or areas that aren't classified as severe mental illness. That number was a lot higher, and I believe it was in the 40s. I can send you, Jessica, the data slideshow that Wayne State put out. It has those numbers in it, and then you can get it out to the group.
The study from Wayne State, was that done pre-COVID? I would guess it probably was.
Yes, COVID was just starting, so it'd be interesting to see. Yeah.
I've read just a couple studies how COVID affected like the mental health of Americans, and it is spiked. And the substance use disorder and co-occurring disorders. So I would be interested in seeing a recent study, and then compare just to see, because I know that in Otsego County, study I just read from the state court said that Otsego County has the highest incarceration rate per capita. And when I went in and looked at the inmate log, out of the 44 inmates, 30 of them are incarcerated for a substance or alcohol use disorder. And I would guess that out of those 30, probably at least 25 have a co-occurring disorder, probably some type of depression or anxiety or, something like that. But I have to get off of this meeting.
The one thing, Thomas, we'll talk soon, but I wanted to say the one thing I heard about the Wayne State study was that they had to have a diagnosis, and that's why the number was low.
So small.
Is because they were counting people with a diagnosis, and so few people actually have an official diagnosis.
Right, that's what I was thinking too. A lot of these people probably have a diagnosis.
Mm-hmm.
Because they probably haven't seen a psychiatrist or somebody to give them the diagnosis.
Right.
Yep.
Yeah, because honestly, any person incarcerated that I've ever dealt with, they all have at least some sort of depression, anxiety.
Yeah.
Anxiety is a lot. So.
Well, and I'll send out the slides, and that'll give you a better idea of how they did their sampling, the measures that they used. Some of them were already diagnosed, but not all of them. Some of them were identified by staff. So it'll spell it out a little bit better.
Oh, that's great. Thank you. That would be wonderful. I would love to see those, and I'll share them with Thomas too.
Excellent.
All right. Well, I want to thank everybody for being here.